you ever thought that you heard someone call your name, or thought that you saw something out of the corner of your eye when in actuality there was really nothing there? Sure, our mind plays tricks on us occasionally, but it is that very mind that allows us the ability to determine what is real and what is imaginary. However, in children and adolescents with schizophrenia, there is no line between real and imaginary. I feel that I'm qualified to bring this information to you today because of my extensive research on the subject and my many years of work in a pharmaceutical setting. Childhood schizophrenia is a severe brain disorder in which children interpret reality abnormally. Today, I'm going to share with you the various symptoms, types, and treatments of childhood schizophrenia. First, I'd like to share some common symptoms of childhood schizophrenia. According to MayoClinic.org, some early signs of childhood schizophrenia include language delays, late or abnormal crawling, late walking, and other abnormal behaviors such as rocking or arm flapping. Do keep in mind, however, that some of these symptoms do fall into other developmental disorders in the autism spectrum. As children age, schizophrenic symptoms increase and mature. Some common symptoms of schizophrenia in older children include hallucinations, delusions, withdrawal from social situations, sleep problems, depression, and irritability. Children are more likely to experience visual and auditory hallucinations than adults with schizophrenia, meaning that they are more likely to hear or see things that really are not there. Secondly, I would like to go over a couple of types of schizophrenia. The most treatable type of schizophrenia, according to healthyplace.com, is paranoid schizophrenia. In children, paranoid schizophrenia presents with frequent auditory hallucinations and unexplained anger. Severe anxiety and agitation are also common in children with this type of schizophrenia. Another type of schizophrenia is catonic schizophrenia. Children with this type of schizophrenia will have one of the two behavior spectrums. Either they'll be increasingly hyperactive or they will be dazed or in a coma-like state. This type of schizophrenia has similar characteristics as attention deficit hyperactivity disorder, or ADHD, when found in children. Thus bringing us to our final topic of discussion, the treatment options of childhood schizophrenia. There are numerous medications available for the treatment of childhood schizophrenia according to the National Institute of Mental Health's website. I'm only going to cover a few today. Various antipsychotic drugs such as Risperdal, Abilify, and Seroquel are used commonly in children who suffer from schizophrenic symptoms. Stimulants such as Adderall, Focalin, and Ritalin are prescribed to children who suffer from the hyperactive category of schizophrenia, which we discussed earlier. There is also non-medication alternatives to schizophrenia treatment. Psychotherapy, also known as talk therapy, is used to help people with schizophrenia learn to understand their illness. With this type of therapy, children are taught strategies to cope with their stresses and unhealthy thoughts that are associated with schizophrenia. In conclusion, the purpose of my speech was to inform you about childhood schizophrenia. Throughout my speech, I have given you various symptoms, types, and treatments of childhood schizophrenia. I again feel that I was qualified to present this information to you because of my research and many days working in a pharmaceutical setting. 1 in 10,000 children are affected by schizophrenia today, and males are more prevalent than females by double to have the disease. So remember, next time you think that you heard somebody call your name, be thankful. You can justify whether it was real or imaginary. Thank you.